Right now, syphilis cases are surging in the United States at its highest level since the 1950s.
The people of America can eradicate the venereal diseases.
Rates of the sexually transmitted infection, once nearly eliminated in this country, skyrocketing for every age group, with experts pointing to a bunch of different reasons for this.
This is unfortunately a symptom of not investing in the American public health system in the way that we need it to be invested in.
One of them, substance abuse, that's on the rise and goes hand in hand with more risky sexual behavior. And another, maybe surprising one, the advent of PrEP, a highly effective drug for preventing HIV introduced in 2012.
It's time to step up. Prep up.
That hundreds of thousands of men who have sex with men take. A national annual survey shows condoms went from the top contraceptive tool for 75% of men in 2011 to just 47% in 2022.
It appears that there is this sort of false confidence that, well, I'm not going to get HIV, therefore I'm no longer going to use condoms.
And this comes as we're also seeing a culture shift around sex as younger people also don't remember the 1980s and 90s and the fear surrounding AIDS and HIV at the height of the AIDS crisis. And with so many health crises, this syphilis epidemic is affecting Black and Latino men disproportionately. The latest data from the CDC shows cases up nearly 5 times as much for Black men than white men.
Communities of color have always and still are disproportionately affected by almost every disease.
The same patterns exist with HIV as well. And making things even harder for communities of color, just 11% of Black people are on PrEP, 20% of Latinos, compared to 78% of white individuals. All told, suggesting prevention and treatment for HIV and syphilis are not reaching Black and Latino people as well as for white people. And if left untreated, STIs like syphilis can lead to long-term issues, chronic pain, infertility, and can even spread to other parts of the body, like your heart and your brain. But with the right antibiotics, syphilis is treatable. But we should note, there's a shortage of these medications, like penicillin right now, due at least in part to the rising cases of syphilis. And while cases are soaring, funding to fight it is not. Just last year, Congress cut $400 million in funds for disease intervention.
There are studies that show for every dollar we put into prevention, we save a lot of money on the healthcare system side.
With right now more questions than answers on how the syphilis epidemic will get under control.
Yasmin is joining us now. Like a lot of health crises, right? This is not just one thing, as you've laid out in your piece. It's like a whole bunch of different things that kind of come together. That can sometimes make a solution harder to tease out.
Yeah, I think that's kind of part of the problem, right? It's this confluence of all these issues. You just heard $400 million in cuts, right? Lack of investments. Who is it affecting? Black and brown individuals mostly. That could be one of the reasons in which it's not being invested in. You talk about an increase in substance abuse. We have this use of PrEP, right? So people feel kind of immune to getting other diseases, and they're not necessarily practicing safe sex as much as they should. And then there's the culture, Hal, that I mentioned in my piece.
Yeah.
Of sex right now, right? And they're not necessarily remembering the AIDS epidemic. So because of all of this happening at once, it's hard to figure out why it's happening.
Yasmin Vasugian, an eye-opening piece there. Thank you very much for bringing that reporting to us.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.